Anyway, thank you for showing up. And this is going to be a good thing for Rusk County, because I know that the pharmacists and stuff have all been people trying to bring them to them, and they can't do anything with them. So now they've all got somewhere that they can send them. A lot of people don't realize how many drugs that we take off the streets every day on natural deaths, people who pass away at home and stuff, and all their medications. We've got to do something with them. So between this box and the incinerator that we bought 2 years ago, Rusk County now has a means to destroy these medications and get rid of them and get them off the street and away from our kids.
Well, thank you all for taking the time to come and be with us today. My name is Susan Anderson. I am the coordinator of the East Texas Substance Abuse Coalition. Kind of wanted to start off by explaining a little bit about what we do. So the East Texas Substance Abuse Coalition is made up of members in the community, and we represent a lot of different sectors, and we work collectively towards one common goal, and that is to prevent and reduce youth substance abuse. So, whenever substance abuse affects so many people, it's a public health issue, and it requires a more environmental, vast approach. And, we have to rely on the expertise and the knowledge and the skills of so many different people to sit around the table to come up with real tangible solutions. So the people that sit around the table as part of our group, we have representation from law enforcement, media, business community, health, treatment, recovery, and the list goes on. So our coalition actually focuses on preventing and reducing underage drinking, marijuana, synthetic marijuana, and prescription drug abuse. And obviously this effort right here has got to do with our efforts to prevent prescription drug abuse, which is actually driving the nationwide drug epidemic. So drug overdoses have actually become the leading cause of accidental deaths within the United States. The death toll has far surpassed the peak of gun deaths, HIV/AIDS, and car crashes, which is insane. And the crazy thing is, 6 out of 10 of those deaths involve an opioid of some sort. So when I talk about opioids, I'm talking about the illicit kind like heroin and fentanyl, and then the ones that are just prescribed by your doctor, like Oxycontin, hydrocodone, Vicodin, things like that. Preventing substance abuse is a lot easier than rehabilitating somebody who's already been addicted. So somebody who's addicted to drugs, they can find sobriety and live in recovery for years and years with a lot of hard work. But the truth of the matter is, the vulnerability to drugs will always be there for the rest of their lives. And on top of that, people who are addicted, it affects the whole community, not just those living with the addiction. So we're really thankful that the Rusk County Sheriff's Office has worked with us on putting a prescription drug drop box in, because we know that by collecting prescription drugs, especially opioids, off the street, that's out there in the community that has the potential for illicit use. But it actually provides more benefits to the community than just preventing potential misuse, abuse, and addiction. It also prevents water contamination from medications being poured down the drains or thrown in the trash, or flushed down the toilets and things like that. And it also reduces illegal narcotic sales and drives down property crimes. And so it has a lot of benefit to our community. And so now, this is going to be available, super easy to use for the Henderson public. They can come in and drop off any unused prescription medications 24 hours a day, right?
24 hours a day.
24 hours a day, and no questions asked, which is a great asset to the community. And we are just so beyond thankful for this partnership. I actually have a program and flyer, and the flyer at the back, it just has the address, it has information about it. I know some of you didn't get one, so I'll make sure you guys get one. But anyway, we would love to get this information out as much as possible to the community. So if you work in healthcare and you have the ability to get this information out to your patients, that would be absolutely amazing. But I have my information on here, so if you wanted to reach out to me, I can get you an electronic version, and we can we can get this out. And honestly, to really combat this issue, it's going to take a collaborative effort in this whole entire community. So it takes people disposing properly. We need to change the norms around people maybe stockpiling their drugs for a rainy day, or people not seeing it as a big deal to share their medications with other people. We need to change that thought process and make it to where it is absolutely normal to come and get rid of your prescription medications instead of leaving them in medicine cabinets. The thing is, research actually shows that most teens who misuse or abuse prescription drugs, they get them from usually a medicine cabinet for free from a relative or a friend. And so getting rid of these medications is going to be, I think it's going to really make a dent in the crisis that we're seeing today. Do you have any extra words?
I know that the pharmacies and the medical people and stuff have been wanting to have somewhere that they can dispose of this stuff. Now we have it. It's here, it's open. People can bring them by. Just get the word out there. Because everybody's got expired medications or something that they don't need in their cabinets now. And this is a good place and a good way to get rid of them and destroy them.
I know it's on the box. Why don't you go through what's accepted and what's not accepted?
Go ahead.
Okay, so basically, what is accepted is prescriptions, prescription patches, any prescription medications and prescription ointments, any over-the-counter medications, vitamins, samples, and medications for pets. And then this here is what's not accepted, so it's hydrogen peroxide, inhalers, thermometers, any sharps like needles, medications from businesses or clinics, and ointments like lotions or liquids. But is it true that they can bring it and that they would take it here?
If you've got medications, syrups, prescription medications, you can bring them here. Or if you're looking for a place to dispose of insulin needles or anything of that nature, yes. Just package them up and you can bring them here to the jail. And don't put them in the box though, but the people at the window will take them and put them back there in our containers to be destroyed properly.
Yep. Do we have any other questions? Okay. I think we're
And we're done.
yeah. All right.